Thank you very much for your kind invitation to this important congress to speak about the HIFU technique applied to uterine fibroids and pregnancy outcomes. I'm Dr. Rodriguez, the head of HIFU unit of Mutua de Terrassa Hospital in Barcelona, Spain. And okay, come on. The first thing I want to point out about the uterine fibroids, apart from the fact that they are very prevalent and cause significant morbidity in women, is that there is enough evidence about their negative impact on fertility. And this infertility associated with fibroids occurs by different mechanisms that have been described by some authors, such as anatomic distortion of the uterine cavity, and increased uterine contractility, impairment of the endometrial and myometrial blood supply, and hormonal changes induced by fibroids. And on the other hand, we must also take into account the age factor, because as you know, the age remains the single most important determinant of human fertility. Currently, there is a tendency to delay childbearing beyond the age of 32 years, mainly in Western countries. And this situation, combined with the increase of fibroids with age, leads us to a new scenario, which is the large number of older patients with fibroids and problems conceiving. And the advances in new reproductive technologies cannot compensate for this issue. And this is a very serious problem. The effect on fertility impairment depends on the location of the fibroid. As you know, there is evidence that patients with submucosal myomas and intramural myomas distorting the uterine cavity have the most significant impact. On the other hand, some authors support the idea that intramural fibroids greater than 4 centimeters, even without cavity distortion, may also negatively influence fertility. In fact, there are many studies focused on association between this type of fibroids and in vitro fertilization outcomes. And in this line, some publications like this systematic review and meta-analysis conclude that this type of fibroids, even small size, over 2 centimeters, really impact adversely on IF outcomes. However, it also concludes that there is still no definite evidence to indicate routine myomectomy in these cases. We strongly believe that HIFU therapy, but its non-invasive nature, could be a good treatment option for these patients. But it's something that we have yet to demonstrate with prospective randomized studies. Right, on the other hand, when women get pregnant despite the uterine fibroid, they are subject to a specific pregnancy complications such as premature delivery, placental abruption, placenta previa, and abnormal fetal position and other complications. In terms of treatment, there is currently a large arsenal of available treatments, from classical excisional procedures to occlusive procedures, and of course, ablative procedures such as radiofrequency ablation, here on the right, and of course, high-intensity focused ultrasound. Even though so much variety of treatments, nowadays the myomectomy is still considered the gold standard for women with symptomatic fibroids who wish to become pregnant. Surgery to remove fibroids seems to improve fertility, especially in submucosal fibroids. Anyway, if you look at the literature, one wonders if that is really true. I'm sorry, but this Cochrane review of 2020 concludes that there is no evidence for a significant effect on the clinical pregnancy rate after myomectomy of an intramural or submucosal fibroid. And this is not my opinion, it's a published evidence. Nevertheless, there's enough evidence about complications associated with myomectomy, hemorrhage and blood transfusion, organ injury. It can cause pelvic adhesions that may increase the risk of infertility and cause a uterine scar, delaying the time of gestation and increasing the risk of uterine rupture. Okay, what can HIFU offer to these patients? Surely many of you already know that HIFU is an emerging and non-invasive technique for the conservative treatment of solid tumors. But you know, in 2002, one reported that ultrasound guide HIFU was safe and effective in treating uterine fibroids. In 2004, FDA approved the treatment for uterine fibroids. And in 2019, the National Institute for Health and Care Excellence approved HIFU technique and published a medical guidance on ultrasound guide HIFU with evidence-based recommendations. In the same year, ESG Working Group on Surgical Ablative Therapy of Benign Uterine Disease was created, of which our HIFU unit played an active role. According to the Focus Ultrasound Foundation, right now over 128,000 women with uterine fibroids have been treated throughout the world with great success. In respect of the therapeutic principles, the ultrasound waves are delivered by therapeutic transducer, and they travel safely through adjacent tissues to reach deep into the focal spot. Suddenly, a small area of selected tissue is heated between 70 to 90 degrees and is destroyed. Focal spot is guided by real-time ultrasound imaging. Okay, the safety of the treatment is based on its great precision to treat tumors. This is supported by several studies of pathological anatomy that demonstrate a coagulative necrosis with clear and sharp boundary between treated region and untreated region here on the top, okay? And this is the result. On the left, you can see the images before sonication. Here, ultrasound image. Here, ultrasound with contrast, and magnetic resonance with contrast. And on the right, images after treatment that show hyperechogenic changes on the top, okay, and a non-perfused volume of 100% on contrast-enhanced ultrasound and contrast-enhanced MRI here. Okay, in relation to fertility, HIFU safely and effectively achieved ablation of uterine fibroids without damaging the surrounding myometrium, which conserves its biomechanical properties of tension and contractility. HIFU also preserves ovarian and endometrial function. We have some studies that show no significant difference between the antimullerian hormonal levels before and after treatment, with no amenorrhea patients after the procedure, and with no symptoms suggestive of menopause after treatment. In this other retrospective study from the last year, Melkozerova et al. Observed no significant changes in molecular and tissue markers of endometrial receptivity in women undergoing HIFU ablation for uterine fibroids. More and more evidence day by day. And the objectives of HIFU ablation of uterine fibroids in women with gestational desire are on the one hand, to achieve the inactivation of the hormonal and vascular function of fibroids, and on the other hand, to shrink them in order to normalize the uterine anatomy. Both things seek to increase the chances of obtaining a safe pregnancy without the complications of surgery. Okay, we already have several publications with good pregnancy outcomes after HIFU treatment. Large series of 100 and up to 130 pregnancies after HIFU with high gestation rates. The conclusions of all the authors are the same. Full-term pregnancies with a normal delivery and without complications are possible after HIFU. And in these cases, there are no patients or cases of uterine rupture or abnormal placentation. Well, I'm going briefly to talk about our experience with the HIFU technique and the pregnancy outcomes. And I take this opportunity to congratulate my team at the Mutua Terrassa HIFU unit in Barcelona for the recent publication of our work. In our retrospective study, we include 560 women with symptomatic uterine fibroids, okay, who underwent ultrasound guide HIFU between February of 2008 and February 2018. 71 pregnancies of 55 patients have been obtained, which is, to our knowledge, the longest series of pregnancies after HIFU treatment in a Western country. The pregnancy rate was 34%. And okay, among the 71 pregnancies, there were 43 successful deliveries, 20, including a natural twin gestation, okay? 22 first trimester spontaneous abortions, and 6 therapeutic abortions for personal reasons. As you can see in this table, the incidence of cesarean section in our series was 43%, okay, which was much lower than in patients undergoing myomectomy or uterine artery embolization, or in those reported by other authors after ultrasound guide HIFU. Regarding the characteristics of 43 successful deliveries achieved after HIFU, the rate of full-term deliveries was 91%. Therefore, the rate of preterm delivery was 9%, only 4 cases, which is lower than in series of pregnancies with untreated fibroids or pregnancies following uterine artery embolization. The mean birth weight of the 44 newborns was 3 kilograms. 7 of them were low birth weight infants, these that you can see here, okay? Except for the 1.4 kilogram baby who was born with a previously diagnosed tetralogy of Fallot and intrauterine growth restriction, the remaining newborns, 98%, developed well without complications during postpartum and breastfeeding. The complications detected during pregnancy in our series were 1 case of first trimester bleeding, 1 preterm labor, 1 renal colic caused by growth of the myoma, 2 cases of placenta previa, and 2 cases of preterm premature rupture of membranes. In the intrapartum and postpartum complications reported include 3 retained placenta here, okay, with manual removal, 1 of which received a red blood cell transfusion, 1 case of severe preeclampsia that ended in a forceps-assisted delivery at 37 weeks, and 2 cases of emergency cesarean section, 1 case for fetal bradycardia and the other for hemorrhage associated with placenta previa, okay, with no consequences for the fetuses. It should be noted that this series had no cases of uterine rupture or placenta accreta, which can occur after myomectomy or UAE. Regarding the clinical outcomes of the treatment in the 55 women who became pregnant, HIFU ablation was followed by substantial shrinkage of the ablated fibroids with significant symptom improvement. Okay, we must highlight that these results were achieved in women with a medium maximum diameter of treated fibroids of 6.4 centimeters, okay, and a non-perfused volume ratio of 76%, which is higher than that reported in most series of HIFU treatment. Only 5 minor complications were observed. In 1 patient, the 10-centimeter fibroid treated was almost completely expelled from the vagina 6 months after HIFU ablation. Another patient had vaginal discharge of the treated fibroid 2 months after HIFU. 1 patient had a first-degree skin burn, and 2 patients had self-limited hematuria. No major complications such as bowel or bladder injury or nerve damage occur, and no patients develop amenorrhea after HIFU ablation. Okay, then I'm going to present some interesting cases. This is a 30-year-old woman with a previous premature labor with hypermenorrhea, anemia, and secondary sterility. As you can see, she had a transmural fibroid of 10 centimeter. It is hypointense here, okay, and has a low vascularization. Both are very good characteristics to HIFU, okay? And we achieve a complete ablation of the fibroid. In this image, you can see the great non-perfused volume, 100% of the fibroid was ablated. MRI 6 months later showed a reduction in the size of the fibroid to 2 centimeters. Just then, the patient underwent a hysteroscopic resection for the remaining myoma fragment. And this is the hysteroscopic video after HIFU and surgery showing a normal uterine cavity. The woman became pregnant spontaneously 3 months later and gave birth to a healthy baby weighing 3.5 kilograms. This is another patient, a 33-year-old nulliparous woman with hypointense submucosal fibroid of 6 centimeters and hypermenorrhea. You can see in this image the myoma occupying the whole uterine cavity, okay, with vascularization, with high vascularization, and in small areas of low vascularization. Contrast-enhanced image immediately after HIFU here showed a non-perfused volume of 100%, the whole fibroid. 6 months later, the myoma completely disappeared with restoration of normal uterine anatomy. This patient achieved 2 full-term spontaneous pregnancies that ended in uncomplicated vaginal deliveries at 38 and 37 weeks. Okay, as a conclusion, so message to take home, uterine fibroids can negatively affect fertility and increase the risk of specific pregnancy complications. And myomectomy has some disadvantages that we should consider, as I said before, especially in women who have desire to conceive. According to our experience, ultrasound guide HIFU therapy is an effective and safe treatment for uterine fibroids. Ultrasound guide HIFU makes it possible to obtain full-term pregnancies with few intrapartum or postpartum complications in patients with benign uterine pathology, fibroids or adenomyosis. And due to its non-invasive nature, HIFU should be the first therapeutic option in women with uterine fibroids and gestational desire, with many advantages over myomectomy and uterine artery embolization. And of course, we need prospective randomized studies to confirm these observations. And that's it. Thank you very much for your attention. I leave my email address in case you have any questions. Right now, I hope to visit you in the future, but in person, and do enjoy a country as wonderful as Japan. Okay, that's right. Thank you very much. Bye-bye.